The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Thank you, Dr. Makary, for appearing before the committee. The Food and Drug Administration is tasked with overseeing everything from drugs that treat debilitating diseases to safeguards in the U.S. food supply. While FDA has become a gold standard around the world in safeguarding public health, the agency faces significant challenges. The bureaucracy has led to delays in approving new medicines and devices, restricting patients' access to innovative treatments that can be life-saving. As the Trump administration looks to cut red tape across the federal government, the agency should look at innovative ways to address bottlenecks in the review process. This could include using artificial intelligence and other technologies to improve efficiency and accelerate drug discovery while ensuring these products are safe for Americans. Another topic of interest is food safety. Americans deserve to know that the food they buy for their families is safe to eat. One place to start should be examining FDA's review process to ensure the safety of ingredients that go into foods. I know Dr. Makary is passionate about this issue. I look forward to working with him if he is confirmed. The American people's trust in our public health and science agencies and the products they regulate must be restored. Rebuilding public confidence in medical products like vaccines is especially important as we respond to measles outbreaks and as FDA considers recommendations for vaccines for flu strains ahead of the upcoming flu season. Dr. Makary, with his experience as a surgeon and an effective health policy communicator, can help our public health agencies rebuild trust with the American people. Thank you for appearing before the committee and discussing your vision on how to make America healthy again. Senator Sanders is not here, so Dr. Makary will go to you for your opening statement.
Great. Thank you, Senator Dr. Cassidy and Ranking Member Sanders and members of the committee. I'm humbled to be before you here. I'd like to thank President Trump for his confidence in nominating me to lead the Food and Drug Administration. I'm joined today by my wife, Jessica, my sister Maria, my brother Mark, Nora Jacoby, Alexander Jacoby, and my very sacrificial mother, and my career role model, my father. My father dedicated his life to the care of children with leukemia, lymphoma, hemophilia, sickle cell disease, and then turned his attention to adult hematology. His father, my grandfather, was a pharmacist in a poor Egyptian community and believed in treating everybody equally, especially the most vulnerable among them, a philosophy I've tried to emulate in my career and research. Even from the African continent, my grandfather looked to the U.S. FDA for trusted guidance. That's because the FDA has a long history of using gold standard science to uphold public safety and help us, as clinicians, take care of patients when they come to us for help. As a kid, I vividly remember being in the grocery store in our small town with my dad when somebody would stop him, break out in tears, and give him a long hug after what I would learn to be a decades-long battle with lymphoma. It happened a few times, and each time it inspired me even more. For 22 years now, I've had the privilege to walk into the Johns Hopkins Hospital to live out that mission. And each morning as I enter the front door, I pause and look at the 9-foot statue of Jesus that stands in the center of the hospital lobby. And I read the sacred text engraved at the base. "Come to me, all ye who are heavy laden, and I will give you rest." I'm grateful to Johns Hopkins for allowing me to have a creative career, a dual career, as both a surgical oncologist and a healthcare public policy researcher. In addition to using FDA-approved devices and medications, my research, which has now spanned over 300 scientific peer-reviewed articles in the medical literature, has focused on what's actually making a difference in helping people, and how healthcare has become too fragmented, too cold, and too corporate. My research and subsequent book on price gouging and predatory billing in healthcare turned into advocacy to demand more transparency in healthcare. President Trump heard the plea and invited me to the White House in his first administration to enact the nation's first executive order to bring down hospital and drug prices through greater transparency. The reform was entirely bipartisan, just as President Trump and Secretary Kennedy's call to make America healthy again by finally addressing the root causes of our child chronic disease epidemic, a message that's resonated with moms across the country regardless of their politics. A smarter FDA that works for all Americans should be a goal we can all agree on. As a scientist who has spent a career evaluating medical interventions, I believe in the scientific process. In addition, I also believe that we can use common sense. Dr. Cassidy, as I have been in the operating room, as you would relate as a respected hematologist, it's hard to perform a long, sophisticated operation for liver cancer and not ask why our rates of liver cancer tripled in the United States. We now have a generational opportunity in American healthcare. President Trump and Secretary Kennedy's focus on healthy foods has galvanized a grassroots movement in America. Childhood obesity is not a willpower problem, and the rise of early onset Alzheimer's is not a genetic cause. We should be, and we will be, addressing food as it impacts our health. Thanks to the courage of President Trump and Secretary Kennedy, we now have a generational opportunity to usher in radical transparency to facilitate more cures, meaningful treatments, and diagnostics at the FDA to help people take care of their own health. My father told me to write down my observations and my experiences in healthcare and the research I delved into. Much of the research I did focused on the fundamental question, is what we are doing working? I wrote books to educate the public on medical science and to empower them to live healthier lives. If confirmed, I hope to ensure the FDA holds to the gold standard of trusted science, transparency, and common sense to rebuild public trust and make America healthy again. Thank you, Mr. Chairman.
Thank you, Dr. Makary. I'll start with questions. In 2021, a few months after President Biden took office, FDA announced it would no longer enforce the in-person dispensing requirement for mifepristone, the drug which obviously is an abortifacient. Now, this is concerning to me. There is a case out of Louisiana which is incredibly egregious, in which there was no recognition that the person requesting the drug was not the patient, but rather someone who was going to allegedly coerce the person into taking the medication, which would have been evident to a physician should she or he have seen the patient. So if confirmed, would you reinstate the in-person dispensing requirement as well as reporting requirements for adverse events and other complications associated with the drug?
Thank you, Senator. And to hear of someone being coerced to take mifepristone is deeply disturbing, and I might even suggest criminal. I have no preconceived plans on mifepristone policy except to take a solid, hard look at the data and to meet with the professional career scientists who have reviewed the data at the FDA and to build an expert coalition to review the ongoing data, which is required to be collected as a part of the REMS program, the Risk Evaluation and Mitigation Strategy. It is pursuant to the REMS, and so if we're going to collect data, I believe we should look at it.
Last week, the FDA announced it would cancel its annual Vaccines and Related Biologic Products Advisory Committee, which meets to select anticipated virus strains for next year's flu vaccines. Now, I'm told by people who are familiar that the FDA will make the recommendation and that they will come up with the right decision. But they also say what is lost is the transparency, because the open meeting allows a post-mortem, if you will, as we say in medicine, a review of last year, what went right, what went wrong, and how to make it better. I think one of the laudable things about Secretary Kennedy's positions is he wants more transparency in terms of how the federal government makes medical decisions as part of restoring that faith. And so, frankly, this seems to kind of go backwards on that. So how will you ensure that advisory committees remain objective, transparent, and still benefiting from the necessary expertise of external experts?
Senator, thank you for the question, and I was not involved in that decision. Certainly, we've confirmed once in office, you have my commitment to take a look at it. As you know, that VRPAC committee takes a look at guidance and recommendations from international groups, such as the GIP International Consortium. My understanding is, at least for the last 7 or 8 years that I've been following that group, we have simply rubber stamped whatever the...
My understanding, though, since these strains typically begin, like in Australia or China, it isn't so much as a rubber stamp, but as much as recognizing what are you seeing, because that's what's coming to us. So just to, I think it's more than quibbling to say that you're learning from them. Your thoughts?
Yeah, so the American public deserves confidence that scientists are looking at that data from the Southern Hemisphere. It's all reported into a registry, all the dominant strains, and then picking the most dominant strains that are lighting up in that registry is that process of really trying to estimate which strain is going to be dominant in the United States. It's not very precise. Some years we don't get it very well, but it's the best we can do with the data we have available at the time. So the group, for example, the international GIP group chose to no longer include the influenza B strains a couple years ago. Sounded like a very reasonable decision, and VRPAC also went along with that recommendation. But I think we're aligned in that the American public want to have some confidence that independent scientists are looking at these data.
And going back to the transparency, again, it seems what's lost with the open meeting is the transparency. So how, as you FDA, how can you, as FDA commissioner, advocate for that transparency? Because we want the American people to know, and obviously canceling the meeting will kind of shut that door a little bit.
Yeah. So, Senator, I was not involved in that decision, but
I accept that. And again, yeah. but you're, man, we're voting for you. So how are you going to make it happen? I guess that's my question.
So you have my commitment to review what the committees are doing, how they're being used. As you know, I was critical when that committee was not convened at all during one of the COVID booster guidance decisions by the FDA. And the FDA career and leadership at the time argued that they're advisory and we don't have to convene them. That was repeatedly throughout the Biden administration. And there may be some value if there's a step where the efficiencies can be made, but I think with something that's important, something that's critical, something where we want expert opinion, it not only provides some of that wisdom, but it also increases the perception of confidence from the general public, which
Thank
is
you. Senator Murray.
Thank you very much. Thank you for being here today. Let me follow up on that, because last week I sent you a letter along with some of my colleagues asking you about the FDA's cancellation of that Vaccine Advisory Committee meeting. For everybody's information, this is a meeting that takes place annually for at least 30 years to make recommendations on which influenza strains should be included in the flu vaccines for the upcoming flu season. And for the first time in decades, FDA canceled that meeting with no explanation given, no new date chosen. That is, I believe, unprecedented and dangerous. And you just referred to it, Dr. McCary. In 2022, you raised concerns when the FDA was considering not holding a vaccine committee meeting to authorize COVID-19 boosters for kids 12 to 15. And at the time, you said it was, quote, unconscionable and the correct vaccine for the upcoming flu season.
Thank you, Senator, for the question, and I appreciated our time together in meeting ahead of this hearing. I was not involved in that decision, and what I would say is
you will immediately reconvene it.
I will immediately reevaluate which sessions the leadership of that center, which decisions, which topics could benefit from.
What goes into a reevaluation? This is done every year, so we know what flu vaccine to have. What are you reevaluating?
First of all, for the last 7 or 8 years that I've been following it, they simply adopt verbatim the recommendation of the International GIP group. But I was not involved in that decision. I will say that there, in my opinion, was a huge difference between requiring every 12-year-old girl in America to take an 8th COVID booster shot versus rubber stamping a recommendation from the International GIP group, which has done 7 out of the last 7 years. I'm not saying that the decision is something I was aware of or involved in, but it's certainly something I will look at if confirmed.